Hi everyone, my name is Amira and I am the CPHO Clinical Fellow at the GPHC. So today I'm briefly going to talk to you about the GPHC's responsibilities for setting the professional standards, as well as this, understanding what it means by the term professionalism and what this means for you and going forward in your careers, as well as the process of revalidation, which is something that you'll be doing once you're on the register. The standards build on and reflect the belief and the attitudes of what we think the behaviours of pharmacy professionals should be. They play a crucial role in enhancing patient safety as well as the quality of care. Central to these standards is the promotion of a culture for person centred professionalism. These standards are what people expect of pharmacy professionals, but also reflect what pharmacy professionals feel that they should expect from themselves, their colleagues, as well as pharmacy students and trainees. You should try to familiarise yourself with these standards as you move closer towards professionalism and consider them alongside the relevant documents that for your education and training providers. Each of the standards includes illustrative examples demonstrating potential ways in how you can meet the standards in practice, but also leaves room for individual adaptation based on your own circumstances. I want you all to take a moment to think about what professionalism means and what it means to you. What does it look like? A professional needs to consistently demonstrate integrity, responsibility, competence, and a commitment to maintaining a good level of practice in one's work. Professionalism builds on the trust and confidence in your own abilities and fosters a positive work environment. Our approach is designed to support professionalism as we believe this is what the most effective way to protect our patients. The GPHC is of the view that it is the professionalism of pharmacists to take decisions that are in the best interest of the patients and the public. This is not detailed rules or regulations that will provide the most effective protection for the patient. There is no definitive rulebook, and as pharmacists, as we take on more increasingly clinical roles and technology and practice advances, you may find yourself faced with complex situations that require difficult decisions to be made. And this is what being professional is all about. Here's a scenario that we can think about when applying the standards. Just take a moment to think back to the 9 standards for pharmacy professionals and think about what you would do in this situation. All healthcare professionals have a duty of candour. This is a professional responsibility to be open and honest with patients when something goes wrong in the event of treatment or care related incidents that result in or have the potential to cause harm or distress to an individual. Regardless of the circumstances you encounter, your primary focus must be on the care, well-being, and safety of your patients. Our standards for registered pharmacies mandate owners and superintendents to empower the pharmacist to exercise judgment in the best interest of the patients. It's crucial to recognise that in any situation, you are not only responsible for your actions, but also your inactions, as sometimes doing nothing may be the wrong choice. Occasionally, errors can occur, and the law assigns the GPHC a specific role in addressing concerns about fitness to practice of these pharmacy professionals. And I just want to highlight, and Jerome will go into this in more detail, that fitness to practice is not a punishment but there to safeguard the public. So, revalidation is something which occurs once you're on the register, and it's a term used by healthcare professionals to ensure that they keep their knowledge and skills current. This involves undertaking and documenting learning and development activities. The GPHC's vision is for safe and effective pharmacy care at the heart of a healthier community, and this is partly achieved by regulating pharmacists in Great Britain. Every registered pharmacy professional must undergo revalidation in order to stay on the register. So, what would you need to do? You will need to complete and submit 4 CPD records. These should all be relevant to the safe and effective practice of pharmacy within your specific context. So, what are you doing within your role? Two of these CPD activities must be planned learning, meaning you intentionally enhance your knowledge or skills before the learning activity. But it's really important to remember throughout the year you are always learning, so make yourself get into a habit of recording key things. You'll also need to include one peer discussion in your revalidation records, and this is where you engage with a peer of your choosing to reflect on your learning and professional practice. And finally, you'd need to submit a reflective account considering how you align with the standards of pharmacy professionals, which we discussed earlier in your role as a pharmacy professional. You're required to submit your revalidation annually during your re-registration renewal through your MyGPHC portal. So why is revalidation so important? It's important as it provides assurance to patients and the public that the trust they have in pharmacy professionals is well placed. And this is achieved by ensuring registrants stay current, by keeping their skills and knowledge up to date, reflecting and improving on their performance, and ensuring safe care for the public, which aligns with professional standards. So, when you get to the stage of revalidation, there are lots of resources available. There's resources on the GPHC website, which can provide sector-specific examples, as well as professional bodies can provide guidance as well. This is not an extensive list, but these are just some of the options which are available.